went in the military in 1965. Spent a year in Vietnam. In '66, I was discharged in 1967. And I was with the 1st Infantry Division. I got active in wheelchair sports. Did basketball for over 12 years. Did all the field events, javelin, shot put, and disc. Then we got involved in skiing. I knew it was something going on with me, and I talked to my primary care doctor at the Spinal Cord Injury Center here in Richmond.
He indicated just overall he felt as if he was slower and having difficulty getting around. One of my first concerns obviously is a change in the spinal cord injury and the level of function associated with that, but it quickly became clear that it was something other than just the spinal cord injury.
One thing that makes his case unusual is that because he wasn't ambulating, the usual features of the slowness of gait, the shuffling would not have been there, but what he was recognizing was that it was getting harder and harder for him to transfer. And it was only when the family was recognizing that he had a tremor that it was more alerted to the possibility that he could potentially have a neurological condition.
It's important for Parkinson's patients to have a plan for hospitalization because all doctors and nurses don't know the specifics about Parkinson's disease. It's a complex illness. The medication regimens and schedules are very individualized.
There's many factors that are involved in treating Parkinson's disease, and when you get to the hospital, they don't go away. Those problems are still there and they don't change, and they may be even more critical when you're in the hospital because you got other problems that are contributing at the time.
People with Parkinson's disease can be hospitalized for all the same reasons other people might be hospitalized for: heart attacks and stroke, urinary tract infections, pneumonia. It's just that they now have a condition, another condition that we have to be careful about, Parkinson's disease, to take care of, as well as the presenting reason for their hospitalization. Here's what should be in a plan for hospitalization for someone with Parkinson's disease. They should keep a list of their current medications, all their medicines, including their Parkinson's medicines, the doses, and the schedules. Their doctors' names and phone numbers, especially their neurologist that cares for them for Parkinson's disease. They should also keep a list of medicines that should be avoided when you have Parkinson's disease. A medical alert bracelet is a good idea. A fact sheet that speaks a little bit what Parkinson's disease is and what their symptoms are. Those are the materials that go into a good hospitalization plan. Put them in a folder or a binder or a bag and have those ready to go.
Usually when I go in for my annual, I go in as an outpatient. A couple of weeks ago, I went in as an inpatient. The day that I was admitted, I came to the nursing station. She looked up on the computer, see that I was being admitted. She printed out my ID. And naturally, I had to inform them about how often I take my medication for my Parkinson's disease.
When John came in for his hospitalization, he did have a kit as far as how to treat him during his stay, with a list of medications, what medications he shouldn't take, as far as the times that he needed to have the medication. So that kit was a very good resource for us.
Parkinson's medications in particular need to be administered timely and make sure that we don't miss a dose, or it can significantly impact a person's function.
They worked with me on it. They made sure that at the prescribed time I was taking my medicine. You know, I didn't have any problem with that.
The best thing that a Parkinson's disease patient can do is to tell their provider that they have Parkinson's disease and take an active role in their care.
When a person who has Parkinson's comes in for something other than their Parkinson's disease, it's really critical that the person advocate for themselves, communicate effectively with us, so that we get the timing and the dosing of the medication optimal.
In the hospital, you encounter lots of people, different nurses on different shifts. So some techniques to do is to introduce yourself to each nurse, remind them that you have Parkinson's disease. Don't be afraid to be vocal and to be persistent, be the squeaky wheel. Remind them it's so important that I get my Parkinson's meds on time.
My advice to anyone with Parkinson's disease is to make sure you have a plan in place. For instance, your kit, let a family member or a friend know about the kit. And if all possible, if you are being admitted to a hospital, bring the kit with you.